unlock the door. Hello, my name is Medina. How are you doing today, sir? Okay, so I'm gonna be your nurse for today. I'm here to do your wound packing and irrigation. Can you verify your first and last name with me? Okay, your name is John Smith. Perfect. So I'm just gonna check your name with the doctor's order that I have. So doctor order stated I have to irrigate your wound with a normal saline and pack it, and your name is all correct. Thank you for that. So I'm just gonna provide the cotton for privacy. I'm gonna wash my hands, sanitize my hand. And Mr. Smith, do you have any pain today? Okay, so he stated that he have pain 3 out of 10 in the real world. I will provide pain management medication, and then I will come back after 30 minutes to do the wound dressing. So for now, I'm just gonna start and go ahead and assess my wound and do the sterile technique to pack and irrigate the wound. So Mr. Smith, before I go ahead and start, do you have any allergies? No allergies, that's good. So I'm just gonna raise the bed up to my comfort level. I'm gonna make sure the side of the bed is down so I can check the wound properly, and I provide privacy already. So I'm just gonna go ahead and start. So my hands are clean. I'm just gonna open the wound right here. So when opening the wound, I just have to make sure I opening the wound away from my patient. How are you feeling? You still okay? Okay, so I'm just gonna assess. I'm gonna assess the drainage. I'm gonna assess the wound dressing for any for drainages, the color, the size of it, and the smell. So it looks good. There is no foul smell on it, and it looks like the wound is healing well as well. So I'm just gonna put this away. Right now, I'm just gonna start to open my sterile field or sterile technique. I'm gonna grab my tray. I'll check for the expiry. So I'm gonna say the expiry date is good, is up to date. I'm gonna check for the integrity of the tray itself, so there is no damage on it. I'm gonna put it back, wash my hands again, because now I'm gonna do the sterile technique. So I'm just gonna open my tray. Just gonna roll it around. Put them right here. Just for the sake of this, I'm gonna hand sanitize my hand again. I'll check if my scissor is on top of the sterile package right there. If it's in top, I'll just grab my forceps and start. If the forceps is underneath, I'll ask my patient to ring the call bell so my coworker can bring me a new forceps. So I'm just gonna pull my forceps, and it's right here. And I'm just touching this part here, is non-sterile. And, just grabbing. So make sure grabbing this the right way. So I'm just grabbing this. I'm gonna give it a shake to have it open up. And I'm just gonna grab it from here. So when I grab it from here, I'm just gonna let go. My hand is still touching this part, and I'm just gonna pull it from here, and I'm gonna set it this way. So now that I set it down, I'm gonna remove this one, and I should have used this one just to place it underneath my patient, just for the dripping and just to prevent from his body from getting wet. So this one is just gonna be under my patient right there, and I'm gonna remove my garbage bag. I'll just place them right there. My forceps, dropping them, the 4x4 right here, and I have my few gauzes right here. So My hands are still clean and sterile. So now I'm just gonna start opening my supplies and place them inside the sterile field. And I just have to make sure there is 1 inches in the outside that I'm not gonna touch. So I'm just gonna start with having this. And I'm just gonna place the scissor, the forceps right here. So the sides outside here, the 1 inch is unsterile, so I'm just gonna place this here. I'm gonna go ahead and open my packing gauze. This is garbage. Just make sure to drop it down there. These are just the normal saline that I'm going to use. I'll place them right here. It's clean. The 4x4 gauze. Just gonna throw it in here. I'm just gonna open another 4x4 gauze. And I have 2x2s. Wrapping another 2x2. Perfect. And now I just have the gauge for my syringe to use. I'm gonna drop it there, and I have the 10 cc's to irrigate my wound with. Just gonna open that. And place it there. And I have my sterile cotton tip. One of my cotton tip, it touches the outside of my sterile field, the outside of the 1 inch. For the sake of the testing, I'm just gonna acknowledge that in real world, I'll ask the client or my patient to ring the bell, ask my coworker to bring me a new sterile cotton tip. So for the sake of the test, I'm just gonna remove this one and throw it out. So now I have everything set up. I'm just gonna, my hands are still clean and sterile. I'm just gonna remove one of the normal saline that I'm going to use, and the expiry date is good, it's not expired. And I'm just gonna open it up right here, throw this out. I'm just gonna make sure to soak my gauze for cleansing, and I'm just gonna put the rest in the other roll right here. Good. So I'm just this one, making sure I'm not crossing my sterile field. I'm just gonna grab my garbage bag. And I'm setting this just away from my patient. I'm gonna set it right here. So now I have everything set. I'm just gonna remove my syringe right here, the 10 ml. Make sure I did draw out the normal saline and it's ready to use. I'm gonna place it here. The same forceps that I used, the green one, I'm just gonna remove it from my field right here, and I'm just gonna come this side and take the packing out. So I'm just checking for the size of the packing itself. And the size is about 3 of the forceps size, so that will be about 12-inch. So I'm just gonna set it in the garbage, and I'll throw my green forceps with it in the garbage. I'm just gonna assess the wound. There is no edema. I'm gonna palpate the side of it. I'm gonna check the inside. The healing ridge is healing well. There is no maceration, and there is no any like full drainage on it. So now I'm just gonna come this side, and I'm gonna put my sterile gloves on. I'm gonna remove my sterile gloves. Touching the outside of the gloves. I'm just gonna remove away some of these. I'm gonna open my sterile gloves. This side. I'm folding it. Just making sure I'm not touching the inside. And I'm gonna set it right here. I'm just gonna hand sanitize my hands again before I put on my sterile gloves. I'm gonna start with this one, and I'm just touching the packaging of the gloves is touching my sterile gloves in the real world. I will ask my patient to ring the call bell, ask a coworker to bring me another set of gloves. For the sake of testing, I'm just gonna continue and do it. So I'm just putting my gloves on. And I'm still just touching the outside of my gloves. I'm putting it on. I'm not gonna worry about 2 of my fingers are going in one. I'm just gonna leave it for now. I'm gonna grab the other gloves and putting my hand in the inside here to grab it. And make sure I have a good grip on it, and putting my other hand inside. So now my thumb is up, so I'm not touching the gloves. Now that I have both gloves on, that are both sterile, now I can fix this one. Just gonna make sure my fingers are good, and all good here, and all good here, and both of them is good. Now I'm ready to start my my dressing. I'm just gonna organize my things here. Everything is sterile. I put my gauze there, my 2x2s, and this one here, my 4x4, and I'm just gonna take my packing strip, and I'm gonna place it in my solution for packing. That's there. Those are just my 2x2s that I have to use to dry my wound, and this is just an extra normal saline if I need to use it. I have my forceps here, and I have my sterile scissors right here. I'm just gonna uncap it. This goes away, and for sure I should use the tip or the needles to uncap to cap my syringe. So I'm just gonna pretend that is here, and it's uncapped here. So I'm just gonna pretend that I did remove normal saline. I have a 10 cc that I'm going to irrigate the wound. So I'm just gonna start from here, going this way, and I have to irrigate it as much time that until the water is cleared or there is no blood on it or anything like that. So this is a 10 cc. I can use 20 cc or 30 mLs until it's all done. So now I'm done with this one. I'm just gonna place it here, and that's okay. It's outside of my field. Now I'm just coming here. I will remove my forceps, remove the second one. I'm just gonna start cleansing your wound, Mr. Smith. Are you still okay for pain? Perfect. So I'm just gonna remove my 2x2s here. And always just make sure the is dry before the cleaning. And for the sake of the testing, I'm just using a one hand to clean my wound. So I'm just gonna clean the inner first. I'll clean the inner. That goes in the garbage. Take another gauze. Just make sure I'm holding it properly. Here, I'm gonna clean the outer of the wound. It goes in the garbage. I'm taking another gauze. Make sure it's dry enough and it's not dripping. I'm gonna clean the inner garbage. Taking one last gauze. Clean the outer and it's garbage. So now I'm just gonna come here. My forceps, both of them, it has to be facing down. Just if there's any dripping, it does not flows back against gravity. So I'm just gonna take one. I'm gonna take one of my 4x4 to dry with. It's gonna make a good fold here. I'll grab it this way, and I'm just coming toward my patient. I do a one pass. That's garbage. Come back here. Take this one, and I'll do another pass here, and it's garbage. So now that my wound is clean, now I have to start the packing. So I have to pack the wound. So my packing, I'm just gonna hold it with this one. Make sure there is no excess fluid on my packing strip. Just gonna make sure it's all dry, and I have about 12 inch of it. So now that is dry, I'm just gonna put this. I don't need my forceps anymore, so I'm just gonna place my forceps in the side, and I'm gonna hold this one. I know what I'm holding. I'm just making a loop in here, making a loop. Okay, so now I'm just gonna come here and start packing my wound. And I just have to make sure I'm not touching the outside of the wound bed itself, just to prevent contamination. Just making sure that I'm tugging it in. Secure it in there. Secure it in there. And just make sure it's only one strip that I'm using, one piece, just for best practice. And then the tip of the packing strip, it should remain outside. And in real life, when I'm packing a peri wound, it should be leveled with the wound itself. It has to be fully packed, not very loose and not very tight. So now that I'm done packing, I'm just gonna come here and grab a 4x4 gauze, and my hands is clean. I'm gonna come here and just drip it off there. Just making sure not dragging it over the skin, so to prevent contamination. Now that I don't need my forceps anymore, I'm just gonna throw it in there, and I'm done with my sterile technique. I can just remove my gloves. Just removing my gloves out. I don't need this anymore. I'm just gonna hand sanitize my hand again. And Mr. Smith, how are you feeling for pain? I have my tape in here. I have my APD, my abdominal pad, just to place over top of the wound. Just gonna go ahead and open it up. Making sure it's still good. Just gonna hold it this way and just the tip of it and place it on top of my wound. Make sure it's secured. Just gonna get my tape right here and tape it. I'll tape this side. I'll have another tape at the side. That's good. Just maybe one more tape in the middle to kind of secure it. Now that my wound is all dressed up and taped properly with the APD pad, I'm just gonna take a small piece of tape. I'm just gonna date it with my initial and the time that I have my I did my dressing, just for the next team. So I'm just gonna date it with today's date is December 14th, and the time right now is about 1410. So 1410 and my initial MYAC and LPN. Just gonna take the tape and place it over top on the other tape, and it's readable and it's done. So now that I'm done everything, I'm just gonna hand sanitize my hand. I can put on another set of gloves. I'm just trying to clean up my sterile field here, making sure everything is done properly. And remove everything away, leaving my garbage. Take everything away from here. So Mr. Smith, I'm done with all my wound irrigation and dressing. Do you have any questions? He stated no. How are you feeling for pain right now? You still okay? Okay, that's good. So just some teaching that you have to give the patient when doing those kind of wound dressing. Do you know why we're packing your dressing? Yes, okay. And also just to kind of promote healing for your wound, you have to eat a high protein diet that will help with to kind of speed your healing process. And you also have to kind of mobile yourself. Make sure that the area is dry, just to prevent infection. And if there's any drainage or you notice that the wound dressing itself is kind of loose, please let the nurses know. They will come and kind of help you or to change you. If you don't have any questions, I think we're done for now. I'm just gonna put the bed back down. I'm gonna put back the two side rails just for safety, and I'm gonna wash my hand and I'll just stick with myself.